Bonjour. You are now affiliated with the French healthcare, the Assurance Maladie. Congratulations, this is not an easy process, but you're not sure how to get your reimbursement and how much to expect. There are two things that you need to do to get the best reimbursement from the Assurance Maladie. First, you need to register your GP, and second, you need to respect the approved healthcare pathway. If you want to know how, I will explain you now how this all works. Welcome or welcome back to my channel. I'm Giga, a French serial expat from Lyon, but also a global mobility professional for the past 12 years. I blog at Expat in France to help English-speaking expats with the French red tape and also the French culture to thrive in France. French healthcare system is different to the healthcare system of the other countries I've lived in, like Ireland, the UK, Argentina, Spain, among others, where the private and public healthcare systems are totally separate. In France, let's say that they are connected. If you are not affiliated yet with the Assurance Maladie, check out the video up there to get a step-by-step guide about affiliation as a worker in France. One important difference that you will quickly notice is that it works on a reimbursement system and not a free access. Patients will mainly pay upfront the medical care unless you are affiliated with the Solidarité top-up insurance for very low incomes. This is now called Complémentaire Santé Solidaire, that was previously called CMU. And then you will receive a reimbursement of a partial amount directly to your bank account from the Assurance Maladie. The Assurance Maladie reimburses about 70% of most healthcare costs and 100% of pre-approved fees for serious or chronic illnesses. If you have not yet received your healthcare card, called Carte Vitale, the doctor will give you a medical receipt called Feuille de Soins to complete and send to the Assurance Maladie to claim reimbursement. The Assurance Maladie reimburses a portion of the medical expenses. Reimbursement rates vary depending on the type of treatment. They are usually around 70% of the fees set by the Social Security scheme, and pharmacy expenses given by prescription only are reimbursed from 15% to 65% depending on the type of medication. The medicines you buy without a prescription will have to be paid at full cost. Note that many medicines in France are not available to buy without a prescription compared to other countries. As the Assurance Maladie only reimburses one part of the fixed rate, it is recommended to take out a private top-up insurance called a mutuelle. This mutuelle is not compulsory but recommended, especially if you have children or need special medical care. Private health insurance, the mutuelle, supplements the Social Security reimbursement, up to a certain amount, depending on the contract you have chosen. It will avoid you costly expenses for unexpected dental care or hospitalization, for example. You will find more information about the French top-up insurance system in the video up there. The first essential step that you need to do to make sure you get the maximum reimbursement from the Assurance Maladie is to choose and declare your chosen doctor to the Assurance Maladie scheme. Why is it important? Well, simply because if you don't, you will be reimbursed only 30% of the Assurance Maladie fixed fee opposed to the 70%, and most top-up insurance will not compensate the difference. This doctor will then become your médecin référent. When you are looking for your GP and taking the appointment for the first time, ask before going if they take new patients. It can be challenging to find a doctor that does in big cities or in some part of the countryside, often called the French medical desert. If they do, ask the doctor to make the declaration of médecin traitant on the Assurance Maladie online platform. This choice is the first step of what the Assurance Maladie calls le parcours de soins, or the approved healthcare pathway. For any medical problem, you must consult your declared GP, and only if the GP considers it is necessary, he or she will refer you to a specialist. You will be given a letter by your GP that you will have to show to the specialist. The document will be scanned and sent directly to the Assurance Maladie by the specialist. Note that only dentists, ophthalmologists and gynecologists can be consulted without a GP referral. Beware that if you do not respect the approved healthcare pathway and see a specialist without your GP approval, you will not be reimbursed for the specialist consultation and any related expenses by the Assurance Maladie. How to choose a GP in France? The doctor's rates will vary from one doctor to another. In France, there are two main types of doctors, including the general doctors and the specialists. First, the state-certified doctors, called les médecins conventionnés in French. Those doctors have a signed agreement with the Assurance Maladie. Most doctors in France fall into this category. Those doctors fall into two categories again. But listen, because this will have an impact on how much you will pay. First, the Sector 1 category. The Sector 1 doctors must follow the Assurance Maladie medical fees, which are the cheapest fees. So, for example, the GP consultation of a Sector 1 doctor will cost 25 euros. Then the Sector 2 category. Their fees are higher than the Sector 1 doctors, but within limits agreed with the Assurance Maladie. It is not rare to have a GP consult at 35 or 40 euros, for example. Then the second category of doctors are the non-state certified doctors, les médecins non conventionnés. They haven't signed an agreement with the Assurance Maladie, who will not reimburse their fee. However, your top-up insurance or private health insurance may cover these medical expenses. In practice, when you go to the doctor, if you choose a Sector 1 GP, you will pay 25 euro fee at the end of the consultation. You will also have to give your carte vitale, and the Assurance Maladie will be informed of the fee you have been charged and the doctor's category you have just seen. You will automatically receive reimbursement of 17 euro and 50 cents, the 70% of 25 euros, on your bank account. If your doctor is a Sector 2 state-certified doctor, médecin conventionné Secteur 2, and charges, for example, 40 euros for a consultation, you will still be reimbursed 17 euro and 50 cents, the 70% of the 25 euros. And then, if you have a top-up insurance, you may be reimbursed up to the full amount you have paid. But how to find a GP? First of all, I would recommend asking around you for a recommendation. Ask your colleagues, your neighbors, or your friends. It is always better to choose it near your home or near your workplace. You can also ask your consulate if they have a list of recommended doctors speaking English or your mother tongue. The healthcare system website, amelie.fr, also provides a doctor and specialist directory. The category is also provided to avoid unpleasant surprises regarding the fee. And you can also search for doctors and specialists on the doctorlib.fr website. You will find the doctor's specialization and localization. The doctors can be filtered according to the language spoken and if they are state certified or not. You will also be able to make the appointment online, which avoids the challenge of a phone call in French. I hope this helped you understand better the French medical system and how to get the best reimbursement. If it did, you can like the video to encourage me, but it will also help other people to find it, and subscribe to the channel for more expat dedicated content. Thank you for watching. Merci et à bientôt.